So Provenge was the first human immunotherapy for any malignancy, which was obviously exciting. As I was saying, it's kind of remarkable that the immune system does anything with such a late-stage disease. Where the original phase 3 trial was conducted, these were men who had very advanced prostate cancer, had failed the existing treatments available to them, and the fact that we really saw a survival advantage across this cohort is honestly, if anything, a little bit surprising and speaks to the power of the immune system even in advanced disease. I think it certainly stands to reason from a logical standpoint the immunotherapy should be used earlier in the course of disease. And there was a subset analysis published from that trial last year, 2 years ago in Urology from Paul Schellhammer, really confirming that concept, right? That the men who had the lowest quartile of PSA in the phase 3 Provenge trial had more than a 1-year survival advantage compared to the men in the placebo arm, whereas men who were treated later had much less of a benefit. And it turns out if you actually look at how Provenge is used in the community now, it's being used even earlier. So the low quartile PSA threshold in that subset analysis was around 25. I don't recall the specific number, but it was in the 20s, 23 maybe. And if you look from a post-marketing surveillance registry that Dendreon has organized, the actual median PSA at which Provenge is being given is somewhere around 11 now. So it's being given earlier, which is entirely appropriate. Again, I think ideally it should be a neoadjuvant or an adjuvant, but obviously the state of the marketplace is not going to be conducive to running a large trial for neoadjuvant Provenge at this stage. So I think we're looking at what the next generation immunotherapies are likely to be. There's a lot of interest in things like Prosvac, in the checkpoint inhibitors, whether that's anti-CTLA-4, the PD-1, PD-L1 pathway acting agents. They're obviously being tested in multiple malignancies, but I think there's clearly going to be interest for prostate cancer. But again, they need to be used at the right stage of disease. If you look at the ipilimumab study that came out in Lancet, it's a very similar finding as the Provenge trial. If you're not going to live 6 months, there's no point in trying immunotherapy. Those curves don't start diverging, and really you want to bring these treatments to bear as early as possible in the course of disease.